So, if like your family, like what would you tell your family, or what would you tell the listeners at home, like good questions or things that they need to know to ask, or what questions should they be asking their doctor to make sure they're finding the right fit?
I think it's important to get to know your doctor and who they are, their priorities, and tell them what you're trying to do. What do you hope to accomplish with this procedure or this surgery? I also think it's important to make sure that who you're going to is an expert. If you live in a small town, there may not be that many options, but in a big city, you don't want to see somebody who's a casual hip replacement specialist. You want to make sure that they're doing that every day or every week, and that's something that's in their wheelhouse. It's uncomfortable to maybe question a doctor, but remember, you're going to be living with the result of that surgery for the rest of your life. So it's important to speak up for yourself to make sure that they're the right person for you. And if you just don't have the right feeling about it, that's okay. Listen to that. I also think it's important to seek multiple opinions, especially if it's a big life-changing surgery. Make sure that the person you're speaking to is the one that you feel most comfortable doing that surgery.
So what question would you say they should ask to find out, speaking knee and hip replacements, what's the question, to ask them on how many surgeries they've done, or what is that?
I think that's a great question. Okay. How many surgeries have you done? Have you done a surgery like this one before? What are you worried about for this surgery, or for me specifically? What complications could happen? A question patients ask me a lot is, what is your success rate, or what is your complication rate for specific complications? I think all those are excellent questions.
Yeah. And do you like it when patients ask that, or
I do
kind of encourage it?
I do.
Questions for me?
Actually, that's kind of how I end most clinic appointments, to say anything else that you need from me, because I want to end with an open floor to make sure that all our questions are answered. I think patients really ask good questions if you give them the chance to. I think there's a statistic that doctors interrupt by the first 20 seconds of a conversation. So I like to let patients just start talking and go through, and then let them finish with the floor. I think it's really important for patients to speak up and have your voice, and make sure that the doctor is listening to you. Don't be afraid to ask questions. And if you feel like your questions aren't being acknowledged or answered appropriately, find somebody else. So many of us love what we do. We love to take care of people. So if you feel like your doctor is not listening to you, or your personalities just don't mix, that's okay. It's okay to go somewhere else. It's okay to get another opinion. And any good doctor will encourage you to do that, just to make sure that you feel comfortable. So open your mouth, ask the questions, bring a friend with you or a family member. Having multiple sets of eyes and ears is always important. And for Texas Best Docs, this is a great resource. It's pretty easy to use. So I would encourage patients and their families to get on there, try it. Most of the time, the doctor that you're seeing does not have any nefarious past. It's going to be great.
Yeah.
But you just want to have that assurance that everything's okay.